Thank you everyone for joining us. I want to give about 60 seconds so that all the participants can get in and get comfortable. Thank you.
Thank you, Alicia.
You're welcome. Hey, Dr. Abraham, always doing that community work. Love it, love it. So we're gonna go ahead and get started. Good evening, everyone. My name is Alicia Coulter, and I am the CEO of Advantage Health Now. Just to let you know what my credentials are to show that I am a trusted source. I have my master's in public health from the University of California, Los Angeles, and my master's in social work from California State University, Dominguez Hills. And I will be your moderator this evening for the community conversation regarding COVID-19 boosters. So again, thank you. And a special thank you to our guest speakers, Dr. Jerry Abraham, Director of Kedren Vaccines in Los Angeles, specifically South Central Los Angeles, and Dr. Shantay Davis. Oh, Dr. Shantay, I do not want to say your last name wrong. Please correct me.
Davis-Balch. Shantay Davis-Balch.
Okay, perfect. Thank you. And she is the first 5 Fresno Commissioner and CEO at Black Wellness and Prosperity Center. And of course, thank you to all of you for joining us for this important conversation. So what I want to do first before we get started is to give you a quick breakdown of our guest tonight. So we have Dr. Abraham. He serves as an advocate for equal access to public health and healthcare for all people across Los Angeles. And through his time working as the director of Kedren Vaccines, he has fought for the rights of several minority groups such as Black, Latino, Asian, and LGBTQIA+ communities, specifically in their right to reliable and non-discriminatory care. Now, Dr. Abraham is a graduate of multiple medical institutions, such as Emory University Rollins School of Public Health, Harvard University School of Public Health, and the University of Texas School of Medicine, and the University of Southern California Keck School of Medicine. Now, why is it important that we go through where I went to school, the credentials I have, where Dr. Abraham went to school and the credentials that he has, and we'll continue to do this throughout the evening? It's because we want to make sure that you all know that we are trusted sources and you can get your information from us and know that we are telling you the absolute truth. He also served, his credentials, I could roll out the red carpet for his credentials, but I must mention that he serves on the faculty of the Charles Drew University School of Medicine, which is considered an HBCU in the state of California, and the UCLA David Geffen School of Medicine, and the USC Keck School of Medicine. Now, many of you may know Dr. Abraham because during the COVID-19 pandemic, he has taken admirable initiatives to ensure that as many members of the Los Angeles community as possible are properly vaccinated and protected from coronavirus. Now, I'm going to put that into layman's terms. What Dr. Abraham did was he made sure that Black and Brown people had the same access to the vaccines that our white counterparts did. So much so, he made sure the Black and Brown folks were at the front of the line in South Central in getting the vaccine. So I just want to thank you, Dr. Abraham, and give you the opportunity to give us some more remarks about yourself and any information you would like to share before we start in our conversation.
Okay, if that's all right, I'll take it away. Thank you
Yes.
so much. It's such a pleasure to be here with everyone today. I'm actually going to take off my mask for this part of the presentation. We're still wearing our masks, social distancing, practicing good hand hygiene, and I'm reporting to you live from a vaccine clinic right here at LAUSD in South Los Angeles. And so we're really excited. The work goes on. And as you know, as you said, we practice what we preach, and I'm doing what I do and what I say I do right before your eyes right now. And that's so important. Credibility is important. Trust is important. We know our history. We know the past. We know people have had lived experiences. They are real, and we must acknowledge them. We must respect that, and we must move from there in a way that protects our community and keeps us safe and healthy. So I'm really honored for this opportunity to be with you all. And really my main message, as it has been, now as we're on truly the eve of the 1-year anniversary that we had these vaccines. Pfizer emergency use authorization of their COVID-19 vaccine came on December 11, 2020. So now it's been 12 months with these vaccines. So on the eve of this 1-year anniversary, we remember all the lives lost. We remember all the lives saved because of the measures that we've taken, including getting these vaccines. But the message has been the same all along. These vaccines are safe, they are effective, they are free, and they are for now everyone eligible, which means people over 5 years old. And for those over 16, they'll be eligible for booster shots now. So that's very important. If it's all right, I'm just going to go through a couple slides and then I'll turn it back over. Okay, one moment while I share my screen. Just going to start really briefly with this presentation that I want to make about just staying safe through the holidays. COVID is here, and we know that Delta continues to spread, and now there are concerns about the Omicron variant. So I want people to be really mindful. We just had our Thanksgiving break, and as we move into our December holidays, we want to be extremely mindful and continue to be vigilant and continue to practice our safety protocols. We know that there are concerns when we travel. You see that they've changed travel restrictions where we need to be tested within 24 hours of landing in this country. Other countries have similar protocols. Continue to practice good hand hygiene. Continue to wear your masks, especially on planes, especially in the airport where there are crowds, where there are people gathering together. All of these places, we are vulnerable and susceptible. And as we've seen, even if you've been fully vaccinated with 2 vaccines, there are people that are getting COVID-19 breakthrough cases. So be vigilant and careful. We're going to get together. We're going to eat together. We're going to fellowship and have time with one another and hug and kiss on grandma and all of our loved ones. Let's be careful. Maybe set a goal that we're going to try to keep the capacity around 10 or less. Make sure you know maybe the vaccine status of those that you're with, and really encourage and acknowledge and applaud people that are practicing those good practices so that that's reinforced, especially amongst our children. Perhaps get tested before you go to your gathering. And it's okay to continue to maintain distancing when possible. Try to maintain good ventilation and cleaning of the spaces that we're going to be in during the holidays. We want to make sure that you continue to practice some of our testing strategies. Testing remains a very important part. You know, there are those PCR tests. They've even gotten faster where you can get results back within a day. They also have the rapid tests, the antigen test that gets you results back in 10, 15 minutes. So those are great ways to make sure you know your status before you gather with loved ones, and make sure you do those tests well. And as you heard the Biden administration mention, we're going to make sure that people have access to at-home testing. And that's really important because testing is not going to go away. As we've seen, even though we're vaccinated, those variants are real, and we want to make sure that we know whether or not we have COVID-19. The next slide is about getting vaccinated. Let's make sure that we are getting vaccinated. Vaccines are safe, effective, and free, and for everyone eligible. That means people over 5 years old, unless they have a medical contraindication. People from 5 to 18 get Pfizer. Everyone else, your choice, your vaccine, your body, your rights. You get Pfizer, Moderna, or Johnson & Johnson. With that, you know, we definitely want you to celebrate your holidays and be safe. And I'm going to take one more moment to just go over some information about our 5 to 11-year-olds, because I know we're seeing some challenges in getting our 5 to 11-year-olds vaccinated. We want to make sure that our parents feel confident and comfortable, and our children in our community, Black and brown 5 to 11-year-olds, they need to get vaccinated just as much as everyone else. So kids absolutely do get COVID-19. Initially, there was data that showed that kids didn't get COVID-19 as much as adults because they don't have the same receptors. Their body isn't as mature as adults. And so sometimes they may not have had the same levels of infection. Now, can y'all still see my screen by any chance? Y'all can. Okay, I somehow lost my screen. Give me one moment. Perfect. And so, but what we saw with Delta, and now what we may see with Omicron, is that because those are more infectious variants, children are, just as adults, more likely to catch COVID. And so we're seeing an increase in COVID-19 rates, even in children. That was actually a very big part of why Los Angeles County here, the Los Angeles Unified School District, where I'm at right this very second, decided to mandate vaccines for people 12 and older because the Delta variant was spreading amongst children. And so we know that vaccines are one of our best ways that we can keep our children safe, especially as they continue to go to school. And we want them to continue to go to school and stay in school. And we don't want anybody to miss out on those opportunities. We've already gone through a lot of struggle and hardship over 15 to 20 months with at-home schooling, independent study. Those are missed developmental milestones for our children. We want to make sure we reclaim those. Vaccines are safe. They've been tested in thousands of children. We know the safety data is there. We know the efficacy data is there. And now as more and more children get vaccinated, we're going to have effectiveness in the general population data, and it continues to really resonate that message that these are safe and effective. And thankfully in this country, these vaccines are free for everyone. Vaccines work. Vaccines really prevent death and serious illness. We have seen children get very serious illness, including MIS-C, multi-system inflammatory syndrome, where they have required serious ICU critical care hospitalizations. We know there are long hauler effects to COVID-19. We've seen all sorts of complications from COVID-19. And so we know that vaccines are our best way at preventing death and serious illness. It does reduce your chance of spreading it, and it reduces your risk of catching it. So while there are people who were vaccinated who spread it, while there are people who get COVID and they were vaccinated, it happens far less than those that are unvaccinated. And the vast majority of cases still, when you look at who's in the hospital, when you look at who's dying, when you look at who's positive, they really predominantly still happen in the unvaccinated. So the data, the truth, I always say, sets us free. The truth will set us free, and COVID-19 vaccines are safe, effective, and free, and they're our best tool at preventing the spread, at preventing serious illness in our community. For ages 5 through 11, we now have a pediatric dose. It is 1/3 the dose of the adult Pfizer COVID-19 vaccine. We use a smaller needle. We space them just like we would for the adult dose. It is 17 to 21 days between the two doses. For children ages 12 and up, they get the regular Pfizer dose, which is also a 2-dose, 3 weeks apart. These vaccines for children are an mRNA vaccine. Just remember how far we've come with vaccine technology. We've been using vaccines for over a century now. We've eradicated smallpox with vaccines. We don't see polio in this country anymore because of vaccines. Many of our kids have vaccines to go to school: measles, mumps, rubella, chickenpox. HPV vaccine prevents cervical cancer in women. We survive the flu and pneumonia, unlike our predecessors, especially our elders, lived through cough, cold, flu season, pneumonia season because of these vaccines. So just know that vaccines are very important and they work, and these vaccines are no different. And these are newer technologies, and in fact, far safer technologies than some of the older vaccines we used to use that would have live or dead virus in them, that may use older technologies. And mRNA really lasts in the body only for a couple of days, and then it is excreted just like everything else in our body through our urine and through when we go to the bathroom. So really that mRNA delivers the message. It's a vehicle with information in it. It delivers that in your muscle, then it tells your body how to make antibodies so that you can defend yourself when when you come into contact with COVID-19. The most common side effects, as many of you have seen yourselves, is pain or swelling at the site of the vaccine. Some people feel a little under the weather, maybe some mild flu-like symptoms. This is called reactogenicity. It's very common. We actually see less of this in the younger children, in the elementary, middle, and high school children. But if you have those symptoms, by all means, please take Tylenol or ibuprofen, dampen those reactogenicity symptoms, so that way you're a little more comfortable. Most of those symptoms resolve within the first 2 days. The vast majority of issues that results from vaccines happen within the first 1 or 2 days. And the vast majority of those are caused by food and medication allergies. The vast majority of vaccine issues are resolved within 6 to 8 weeks. There are no proven long-term consequences of vaccines, and we've seen that with all the vaccines that we use. No link between vaccines and autism, no link between vaccines and cancer, no link between vaccines and infertility. Very important for our parents to have all those informations, those facts, so that way you can make the right choice for you and your family. We'll continue as we move into this cough, cold, flu, pneumonia, now COVID-19 season, to monitor what happens with Delta, now with Omicron. As much of the world still needs to get vaccinated, there's still the risks. New variants will emerge. We'll continue to monitor that. We may be staring at a 5th wave that emerges this winter. And then come after this winter, we suspect that we may see a more mild form of COVID-19 that we learn to live with. Still too early to say. We may learn that we need an annual COVID-19 booster or vaccine. Again, it's something that we'll continue to monitor over time. So I really hope that this has empowered you all to go and get your 5 to 11-year-olds vaccinated. There are many places you can go, including your local doctor's office, your pediatrician, local pharmacies. Many schools, like for example, all throughout the state of California, are hosting vaccine clinics as well. We really want to continue to advocate for our children's and our students' health in our schools. So continue to practice all the safety measures. Our schools are doing everything they can to keep them safe and healthy when they're at school, with social distancing, mask wearing, with their testing strategies, vaccine strategies, with their electrostatic spraying, keeping our schools clean, with improving our ventilation and air filtration systems. All of these, this is like the layers of an onion. This layering effect is really what ultimately will keep us all safe. And when we do all of these things, we can finally truly end this pandemic, turn the page on this chapter, stem the tide, and we can all move forward with a new sense of normalcy and get back to all those things that we love to do, where we get back to work, back to school, back to having fun and hugging and kissing on grandma, and reclaiming all those missed moments that were lost in the last 15, 20 months. And so with that, I'll turn it back and we will continue our presentation. But I wanted to share that with you as we really have some perspective as we move into the holidays, and also as we see people, parents particularly, very concerned about making the right choice when it comes to getting their children vaccinated. And I remind everybody on this presentation, in this forum, you want to keep your kids safe and protected. That's what we want to do as well. So we share that common goal. We believe and we know from the data that the best way to do that is through the vaccine. And we want to make you feel comfortable and hope that you come to that conclusion as well. Thank you so much.
Thank you so much, Dr. Abraham. You know, you're right. We're a year into this, and a year into the vaccine season, right? For against SARS-CoV-2, COVID-19. And so those refreshers are always great. You can never have enough refreshers. So we appreciate you for doing that. Ms. Shantay,
Association for his leadership and for his compassionate care. And I just think that's so important to highlight, because we really, during this pandemic, we have had some incredible leaders who have stepped up and come to the front line to demonstrate their commitment to serving our communities, their commitment really to addressing health disparities. And so I just want to say thank you, Dr. Abraham, for everything that you do, for your leadership, for your passion, and for all of the energy that you bring. We're all trying to figure out, how do we get the same level of energy? So thank you. So just a brief introduction for myself, or
No,
Alicia.
wait, I'm gonna do it. I got my computer literally
Okay.
just blacked out on me. It just blacked out on me. It turned all the way off and then
Oh,
rebooted.
but
So
you're back now, so it's
yes.
okay.
No, I want to make sure that you get your introduction. So, and I would love if you would speak specifically, if possible, to the pregnant women or pregnant individuals in regards to the vaccine and the safety, if at all possible, because you serve as the maternal child health director for the Central San Joaquin Valley with the March of Dimes. You, Ms. Shantay leads the statewide maternal child health committee and is the advocacy and government affairs liaison and is the March of Dimes co-lead for statewide health initiatives. And so Ms. Shantay is a proud Fresno Pacific University Sunbird, where she completed her undergraduate studies in healthcare administration and graduated with honors, high honors, summa cum laude. She received her MBA from Johns Hopkins University Carey Business School with a specialty in healthcare management, and is a certified lactation educator with expertise in premature birth, infant and maternal mortality, and breastfeeding. Ms. Shantay focuses on building non-clinical capacity and infrastructure to address outcomes in prenatal health. So I'm going to make sure I add this. Shantay is a native of Fresno and enjoys gardening in her downtown historic home where she resides with her husband and her 3 children. So I have a husband and 3 children as well. So thank you for joining us.
Absolutely. I'm so happy to be here and so honored really to be among Dr. Abraham, who is such a trailblazer in the state of California. So thank you for having me here. There's so many just areas to address. I'm like, where do I start? So I love March of Dimes, a really close working partner, especially with my colleague down in Southern California, who I'm sure Dr. Abraham is closely connected with, which is Mashariki Kudumu with March of Dimes. And then also just a quick, little update. Things have been changing and transitioning, and I'm also the president and CEO of Black Wellness and Prosperity Center. And so there's so much happening and going on. And in terms of COVID and where we are and our contribution, or what are we seeing, or how are we wanting to really support moms and families? And Alicia, you said, please talk about our pregnant population. So give me a few moments here and I'll get to that. But just a little background. So in the county of Fresno, we came together and we formed the African American Coalition. And we were able to really rapidly identify, recruit, and train about 50 African American community health workers in the county of Fresno. And we got them trained and in partnership with the county of Fresno. And I am really proud to report that the African American Coalition was able to administer just over 2,000 COVID tests. And to date, they have administered just over 9,000 COVID vaccines. And just as Dr. Abraham mentioned, it is really a process of trust and community building being in the community to make sure the community understands, well, who are you? How are you here to serve us? How are you here to support us? And so these community health workers, we recruited directly from the community to be able to help us identify what were the specific needs in the community, and then in real time be able to respond. So we're really proud to be able to report that over 9,000 vaccines. And for folks who are on the call listening in California, you will know that the central San Joaquin Valley is one of the most conservative areas in California. Some of the demographics and cultural norms do not necessarily mirror Southern or Northern California. And that's really an important thing to note, because if we look at boosters and overall vaccination rates, especially in communities of color and in the Black community, what we know is that those rates are the lowest actually in the central San Joaquin Valley among our population. But the African American Coalition has been able to maintain a steady vaccination rate for our Black community at around 38%, which is amazing. And that really has been based on trust building and relationships, setting up our community clinics in places where folks are comfortable, like the gym at the local high school, right, where we have the highest disparities. So I just wanted to mention that. Now, in terms of our specific population, here's what we know. If we look across the state of California, we really do not have concentrated efforts, if you will, to specifically target our pregnant and birthing persons, right? We really have focused our outreach and education just around general population. But here is why it's important to talk about our pregnant and birthing populations. Number one, what we know is that women have a huge impact on family decision-making, right? When it comes to healthcare. And so if we can engage our pregnant moms and help them understand the facts, like Dr. Abraham said, we're your trusted partners. We have credible information. We have, like Dr. Coulter, like, come to us and ask us for information, right? We are trusted sources. And so if we can engage our pregnant moms, we actually have the opportunity to impact 3 generations, maybe more, because if we can engage moms, we know that we have scientific data that says vaccines are safe for you. We are using historical data about what we know about vaccines to know that based on what we know, based on how these vaccines work, these vaccines are safe for you. And by the way, you actually may be providing your baby some antibodies by getting vaccinated. So getting vaccinated during pregnancy is a really good thing. It's an excellent thing. And if we can engage our moms, we can vaccinate our moms. We can then provide a level of antibody support for our babies that are being born. If our moms are deciding to get vaccinated, guess what? They're going to have influence on getting other children vaccinated, 5 to 11 in the household, and they're going to have an influence on helping to get their partners and spouses vaccinated. Because what do we know in communities of color? Men, right, who identify in communities of color don't necessarily seek out healthcare for various reasons. But if they have their partner who is advocating and telling them that they need to get vaccinated, they are more likely to get vaccinated. So one of the things that we have focused on here is focusing on moms, especially pregnant moms. One, because we need more support and information around the safety and efficacy. And number two, if we increase our level of engagement and support around moms, we actually have an opportunity to engage men and children and newborns, because we know that moms sort of drive healthcare decisions in the family. So we're really, really committed to helping our families understand the importance of vaccination, and we're focused on really engaging our mothers. And Dr. Abraham, if you have anything to sort of add to that thought process of focusing on mothers. And another thing that we know is that moms, especially when they're pregnant, they are highly, highly committed and dedicated to doing the right thing for themselves and their babies. And this is actually a moment to really help engage and educate. What is the right thing to do for you, your baby, and your family? How can we support you in keeping you and your family safe? And what we know based on the data is that getting vaccinated is the #1 way that you can keep you, yourself, and your baby safe, and the community, and the community. And I think that's important. So, Dr. Abraham, if you have anything to add in terms of engaging pregnant women, multi-generational approach, especially with infants. And I'll just say one more thing that we're working on here in Fresno. And I also know Dr. Abraham is also working on, which is we don't have a consistent way that we're engaging with pregnant mothers when they're being discharged from the hospital. Dr. Abraham specifically mentioned multi-generational, grandmas, aunties, and all of that. What do you do, for example, when you've had a baby, and how do you say, hey, big mama, you're not vaccinated, and I need you to not kiss my baby. I need you, let's do an introduction to the new baby on Zoom. And so putting those supports in place is one of the primary focus areas around families, is just really focusing on the mama and the birthing process, because that really branches out and transcends to the family. It's multi-generational. So thank you. Dr. Abraham.
Yeah, I will add a couple of comments. I really focused, my message on those boosters and getting children vaccinated, because that really is where so much of the attention lies. But as you know, most of my work has been on increasing vaccination rates, particularly in our community, in the Black community. And we know the fundamental, paramount role Black women play in our community. We know, as you said, Black men get their health care because their moms, their wives, their daughters, their female and women relatives say, did you go? Did you take? You need that screening. You need to take care of your blood pressure and your diabetes. And so we know that's very important to maintaining Black men's health, is really making sure you have a strong Black woman in your life. And we've seen that time and time again. And I've heard that from so many of my Black male patients who have said, had it not been for my wife, I would not have gotten that cancer diagnosed or that chronic condition treated. And that's true of the vaccine too. When, as you mentioned, auntie or grandma has gotten vaccinated, how many people we vaccinate that says, let me call grandma and ask what she got, because I'm going to get what they got.
Right.
So you really understand how important that is. And again, I didn't focus too much today on pregnancy and breastfeeding. And when you look at prenatal care and fertility, these are real concerns of young people.
Yes.
As I always tell our young folks, I really applaud them for exercising, eating healthfully, for trying to sleep better and manage their mental health and reduce anxiety and depression and suicidality in our community. Those are all important, but they don't prevent COVID-19. They don't
Right.
treat COVID-19. So even the young invincibles need to hear, they need to get vaccinated. And pregnancy is a increased risk health state.
Yes.
So you are at higher risk of having complications from the common cold, from pneumonia, and COVID-19. Everything that can affect everyone, it's a little more heightened and more severe when we're pregnant. You really are, caring for two individuals
Right.
at that point, and we really want to be mindful of the health of two individuals. And so it's very important that mothers, especially pregnant mothers, get vaccinated. It is safe during breastfeeding as well, as we mentioned. That's really important that people hear too. And so, and as you pointed, when moms make those choices, then their kids have gotten vaccinated, their households, and then the ripple effect. And we've seen the role of community health workers, or whether it's the Sisters of Watts, whether it is the Community Build and the Metropolitan, Los Angeles Metropolitan of Churches. We are seeing women organize in such an important way that have really driven up testing and vaccines in our community. I think of many of the strong women leaders we've worked with, Maxine Waters, Karen Bass, and so many others here in Southern California that have really helped us, and throughout the state, to be honest. So I really can't, nothing short of echo everything you said, really reaffirm how important that message is. We can never undervalue, and I want to see more of that. And I think you really brought home another really important point, which is we can be trusted. We need to be trusted with the resources. With more resources, we could do more. Who knows our community better than those of us that live here, that work here, that do this every day, that, as you mentioned, generations. We should be the ones that are stewards of the resources, because we get the job done. And guess what? That's how we at Kedren have vaccinated 400,000 people in South Los Angeles. That's how we have vaccinated or tested hundreds of thousands of people in South Los Angeles. We are that trusted partner. Give us more resources and we can take care of ourselves. And the world needs to hear that loud and clear, because often we see, and we saw that early on throughout the pandemic and even through the rollout, we'll come in and take care of you. Well, actually, we have the talent, the expertise. We've got people ready to come and
take care of ourselves.
So give us the resources, give us our vaccines, and we'll get our people vaccinated.
Yeah. Thank you so much, Dr. Abraham, for just reiterating the importance of really working with the family from a holistic point of view. I'm also wondering, for example, if you could just speak a little bit about, so what we know in terms of boosters and initial vaccines. There's a lot of misinformation, right, around the vaccine in general. And there's a strong need to just encourage the community to become fully vaccinated, to just get your first and second dose. And it's really one of the things that I'd like to say that I would love to hear from you from a medical perspective is, one of the things in the Black community, in communities of color, is that moms and families, they take their kids to get vaccinated. It is normal. They want their kids to be healthy. We want our kids to be healthy. And I really just want to speak to the fact that this is another vaccine to help keep us as individuals safe, to help keep our babies safe, and to help keep our families safe. And regardless of the rhetoric of anything that you've heard, we have the scientific data that tells us these vaccines are safe and effective. We already have a culture of getting our babies vaccinated. We do it. We know that there's gonna be a little soreness at the arm. There's gonna be a little soreness at the thigh. And what do? We call ahead. Should I give a little bit of acetaminophen? Should I give a little bit of Tylenol? Because my baby is getting their newborn shots. It is okay This is normal. We need to normalize this culture of the COVID vaccine. Just like we've wiped out polio through vaccination, this is the same process. It's normal. So Dr. Abraham, can you speak a little bit about normalizing our vaccine culture?
Sure. You really remind me of so many important messages here. I wish we had just an endless amount of time because there's so many topics you are touching on. First and foremost, we do a lot of work in churches. And I really do believe that when we partner, I feel like people want to hear it from God and people want to hear it from their doctor. And that's so important. When we partner with our ministers and our pastors, strong messages come through. We know that we teach people not to gamble with their life, gamble with their money. Why would you gamble here when we've got tools, when we've got effective strategies? We don't gamble when we drive our car. We ask our children to buckle up. We put them in car seats. We follow those rules, and those are laws and legislation mandates to keep us safe. And I want people to think about that, as I know the mandates themselves cause controversy and angst. As you mentioned, we don't feel the same way about the flu shot. So we will normalize one day to a COVID-19 vaccine program where we feel just as strongly about getting the COVID-19 vaccine as we would about grandma getting the pneumonia vaccine and getting the flu vaccine. Those aren't controversial. Why should this one be? And as I mentioned, these are some of the safest technologies we have ever seen when it comes to vaccines. So if anything, I'd much rather get these vaccines than the vaccines we had decades ago. And I really want people to think about that. We've gone through decades of working with RNA technology to get to this point. And just remember, while we may not have used a lot of these technologies here, there were other types of SARS outbreaks in Southeast and East Asia, where they may have a very different experience with vaccines. What we saw in the early days of the rollout was Korean communities coming out, busing their church members, busing their grandmas and kids, getting them vaccinated. Why? Because they had a very different lived experience with infectious disease and illness in Korea, and they knew their best protection came from these vaccines. So I totally understand how our own lived experience changes our relationships. So when we talk about distrust and mistrust, I always start every clinic, every space we go into with acknowledging the Tuskegee syphilis trials on Black men, with understanding that there was abuse of Henrietta Lacks DNA cells, and that caused us to develop therapeutics and treatments and diagnostics that we benefit from that she and her family never got credit for. When we look at the undertreatment of Black pain in our hospitals, when we look at the medicalization of racism, I make it very important that we start with those acknowledgements, because we must say, this is not that. This is not an experiment on our people. In fact, to make sure it wasn't, we made sure there were Black, brown, men, women, people of different ages in the clinical trials. I had Black physician colleagues make sure they were in the trials, just so that we can proudly say it was tested on us too. So we're not testing it on you. And so that's very important. We continue to follow those people. And now, with over 200 million people in the United States vaccinated and billions, over 5 billion doses globally, we have so much safety and effectiveness data to show there is no gambling. There is no experimenting. We know a lot. And as you mentioned about polio, as we talked about smallpox, we know that vaccines, if there's going to be any issues, they happen much sooner. First, 1 or 2 days. Resolve most within 6 to 8 weeks. No long-term effects. So when we look at those facts, something else I'll leave you with is, there are demons out there, and we saw those digital demons steal grandma's appointments on My Turn. We also saw digital demons spreading lies to our community on social media platforms. We found out that it's a small handful of people that do it, some 12 or so accounts, right? And they're spread on Instagram, TikTok, Facebook, Twitter. So knowing where your trusted information comes from is absolutely critical, because that misinformation, disinformation, those lies, what do? They kill our people, and they kill people in our community. So the best thing we can do, just as we hear in church all the time, that we're going to preach the truth, we're going to preach the gospel, and the truth will set us free. And that is how we bring light. And so that is the type of salvation message, if you will, that we hear and we preach. And I want to leave this with you as well, because it's so important that we can be a people of faith, and we can also be a people of medicine and science, and those things are not mutually exclusive. And that's so important that we can have faith. But let's not get to the pearly gates one day and God go, why didn't you take the vaccine I gave you? And then we say, well, I had faith and I prayed. Well, I gave you brains and I helped you make those meds so that you can save your community. And we should proudly take it, just like God taught Noah how to make that ark so he can save him and his family. That's the same thing we got to do. Just know that Dr. Corbett helped make that Moderna vaccine. One of a member from our community made those vaccines for us, and we should proudly, with our head held high, take them. So hopefully that kind of addresses some of the things that you brought up. But as you hear that passion, this is what we do every day, and it breaks my heart to see anyone now suffer or die from COVID-19, because it is now needless. It is now preventable, and we can and we should do everything we can to make sure no one suffers from this illness any longer.
And thank you for that, Dr. Abraham. And just, I appreciate you going back to basics, because that's what you just did. You went back to vaccine 101 for fighting COVID-19. So we have these concerns for the first shot. And so I'm hearing these same concerns for the booster. I know people that went out and got their first and second dose, and then I'll ask them, well, have you gotten boosted? And they'll say, I don't know about that yet. And I'm like, no, we don't have time to think about it. So can you give us a quick reasoning why? And when giving that, if you can share with us, because we received a question about the J&J and what should you get boosted with? Now, before we go there, I want to give just like some quick education for Moderna and Pfizer. 6 months after your second dose, or after you're considered fully vaccinated, so second dose plus 2 weeks, 6 months after that, don't pass go, just run to the nearest pharmacy. J&J, 2 months, okay? And you can interchange. You can say, okay, I got J&J, I want to go for Moderna because I heard Moderna gives you that big boost. You can say, I want to go for Pfizer because Pfizer has confirmed that their vaccine is effective against Omicron. So you can make those decisions based off of that information I just gave you. But I would like for Dr. Abraham to confirm why it's so important, and if someone has had Johnson & Johnson specifically, why they must quickly rollerblade to the nearest pharmacy and get boosted.
Dr. Abraham,
Yes,
will you allow me really quick to say something?
Please.
Alicia, thank you for the question. I want to add to your question for Dr. Abraham to respond to, which is, Dr. Abraham, from a community perspective, if you could also address not only the culture of getting vaccinated in the first place, but the culture of how we use different processes. I'm going to use, for example, Tylenol, Advil. Like, we use multiple layers of interventions to help stave off pain, for example, right? Maybe something is targeting inflammation, maybe something is specifically targeting pain. The booster is helping us to continue to build up. And just from the community perspective, because what we hear, going back to what Alicia said, why do I need to get the booster, right? Just from a community perspective, to just really drill down and help us understand, why do we need to get the booster? And how does that relate to ways that we interact with other medications or other immunizations or other things that we do in our life to boost our immunity or to continue immunity?
Yes.
So thank you, Alicia, for letting me just plug that in. And thank you, Dr. Abraham, for just letting me add that as part of the response.
And that's really why I appreciate this forum and this conversation, because this really is a broader conversation about health. And when we talk about Black health trust, and when we look at improving Black maternal mortality rates and improving child outcomes, this is where we need to continue to grow and go, because we have done so much, not only through COVID, even before COVID. So we must continue to build on that momentum, because we've come a long way, honestly, and we now know and we're solidifying that network, those roots in the ground. For example, we can trust ourselves to get this done. So give us the resources, and I bet we'll improve maternal health, we'll improve our school children, student health. All of those things will happen if we do what we did, at least what I did with this COVID-19 program. Let's take it on the road. And so to that point, I don't hear people asking the same questions, even though they should know that Tylenol, just because something's over the counter, doesn't make it entirely safe. We know things like Tylenol and ibuprofen linked to kidney issues later in life. We know that Tylenol associated with liver failure in patients. These are things that are easily accessible and people consume without batting an eyelash, right? And how dangerous those things truly can be. And I talk to people, especially because I'm in schools all day. Well, you asked me about what's in your vaccine, but I also ask you, I applaud you for asking me what's in your vaccine, but I also ask you what's in your chicken nuggets, what's in your hot dogs, what about all those processed foods with all those preservatives that we're picking off the shelves so easily, and mama's telling us to get some vegetables and some fruits, and you don't want that. So why would you be so skeptical of these vaccines, but not even think twice when you pick up all those snacks that are out there, created, artificially manufactured to get us hooked? Like we get hooked on drugs, we get hooked on this junk food, right? And that's the reality. And so putting them into context, and then we talk about clean air and clean water. We talk about food safety. All of these things are very important. So yes, when people talk about vaccine safety, what's in my vaccines, just know it's very important to think about asking those questions about all the exposures that we come into contact with, and that we're constantly taking risks every moment we walk on a sidewalk, and every time we have to go to the emergency room or go to the doctor's office, even when we take or pop that Tylenol or ibuprofen, we're all taking risks. I do want to say, where we don't really gamble, and where I see often in the emergency room and in hospitals, are, while people may ask all these questions about vaccines, they sure don't ask us those questions when we got to put them on a ventilator, or when we got to use new and experimental medications with all sorts of serious side effects on kidneys and livers, when we have to treat your COVID and you have serious illness. So it's really interesting to put that context and perspective, that all those questions, there's no time for those questions. And in fact, right now I have a loved one who just got COVID, is in the hospital, and I had been working on getting him vaccinated for a long time, and he just wasn't ready. And of course, his first thing was, I should have gotten vaccinated.
Too
And
late.
doc, help me. And he's
Right.
so scared. And of course, he's an older Black gentleman who is a smoker, and these are real risk factors that increase his risk of having complications. And now we are having to use monoclonal antibodies, try all sorts of treatments. We know that steroids in the hospital, that can be dangerous. We know putting somebody on a ventilator has a lot of risks, and there are real risks to going in an ICU. Survival rates are not always the best, right? And so this is where we see some of that fatality and morbidity. We talk about long-term complications from COVID. Why would you gamble with that? And I'm never going to give you 100% assurance. That's really important for everybody to hear too. People want to know 100%, but we see that whether you're running a race, whether you're going to run a business, or whether you're going to ask somebody out on a date, if you sit there and do nothing, nothing's going to happen. And we know that for sure. So whether you want to pick Pfizer or Moderna or Johnson & Johnson, you're twiddling your thumbs. But if you don't pick any of them for your first or second, if you don't pick any of them for your booster, you're not going to get anything. And that's really the truth. So sitting there and think about the nuances. I think it's important to hear from your loved ones, hear from your church members, your church leaders, your trusted local, whether it's politicians or community leaders, teachers, coaches, family members, neighbors, right? What did you get? Well, okay, fine. I feel a little more comfortable knowing that people in my community got Moderna. I hear that all the time. Everybody in my community got Moderna, so I'm going to go out and get Moderna, and that's fine. But the reason why it's so important to go get those boosters right now is because the virus is doing what it needs to do to survive and stay around. And that's just the harsh reality, that we have done everything to build up our arsenal to keep ourselves safe and protected. The virus is doing everything it can to stick around, and that means evade our strategies. So what we saw with Omicron is that we see 50 mutations, 30 of which are on the spike protein. And unfortunately, that means sometimes it doesn't always recognize that the vaccine, the antibodies that were created from our vaccine, don't necessarily always recognize these viruses. And so when we get that increased layer of protection, I think of them as infantry, foot soldiers, cavalry, and you're building up your troops and your soldiers. So when COVID comes for you in your mouth, in your nose, you have the ability to ward off, fight off that systemic illness that really causes the serious complications. So again, why would you wait? And we know from the data, 6 to 8 months, there's waning immunity. And so the best thing we can do is get those levels back up. If you don't want to do it for yourself, do it for those vulnerable amongst us, those over 65, those with underlying medical conditions. There are young people that have to take immunosuppressive treatments for their cancer or their autoimmune conditions like lupus and rheumatoid arthritis. We're gambling with other people's lives, not just yours. So if you can't do it for yourself, I always remind people, think about doing it for each other. And when we do that, we will see that community immunity, that herd immunity that provides really that protection, that barrier, so COVID really can't continue to spread. And as long as COVID continues to spread in our community, those are more arms, those are more individuals where COVID can mutate, can change, and new variants emerge. And that's also why it's important to make sure we do get vaccines around the world, including in sub-Saharan Africa, where we see numbers as low as 5% in some of the low and middle income countries around the world. We've got to change that too, because what happens, as we saw in South Africa, will come and affect us in California. So hopefully that kind of answers some of the questions around boosters, but boosters are absolutely important. I know, I hate that just trust us. And they said one thing yesterday and now they say another today. But the truth is, because we get more information, and as an intelligent species on this planet, we take that information, we process it, and we make new decisions and we make new recommendations. And that's what our Food and Drug Administration does. That's what our Centers for Disease Control and Prevention, our National Institutes of Health, we are taking more information, and with that, we are sitting, deliberating, and making decisions to keep us safe and healthy. And what is the alternative? The alternative is plight. The alternative is the continued carnage of COVID. We didn't want that. So we knew the best thing to do was, let's protect ourselves. So we developed vaccines. Well, guess what? We need to improve those vaccines. We're going to do that. We're going to get boosters so we stay protected, because the pandemic has evolved. And as we move to an endemic situation, the learn to live with COVID moving forward, we may learn to live with an annual COVID vaccine, just like we would with the flu shot. So again, a lot of things that are still too early to definitively say, but we should feel comfortable in those facts and grounded in that. And that should provide you the confidence, the vaccine confidence that you need to go out and get your boosters. And as Alicia said, put on your rollerblades and go get vaccinated.
Yes. So Dr. Abraham,
you.
I have a few more questions that I want to ask. And you actually answered my next question, and I kind of want to enhance on that. So working in this space, I always hear, man, the information keeps changing. Y'all keep changing, right? That's what they keep saying. And I'm like, it's not changing. In science, in public health, we say evolving, because we're learning new things as we go through this pandemic, which is, God willing, once every 100 years, at a minimum. That's what we want. And so one of the questions I always get is, well, will we have to get boosters for the rest of our lives? And so you made a great point when you talked about endemic. And for those that do not know what that word means, we study that in epidemiology. It basically just means it's here to stay, but it's not hopefully going to be as much of a terror, because that's what COVID is right now. It is a terror. It will not be as much of a terror as it is right now. And so in understanding that, just if you had a crystal ball, what do you think? Do you think it'll be like the flu and it's, okay, if you choose to get a flu shot, great. If you don't, okay. If you choose to get a COVID-19 shot, great. If you don't, and I'm not saying that right now. I'm just saying, what are your thoughts? Because that's what even people that have not received one shot, I hear that that's like one of their big concerns. Well, see, y'all keep getting all these shots and I don't want all these shots. And it's like, well, I keep getting all these shots because you know what I don't want? I don't want COVID-19. SARS-CoV-2, the virus may enter into my body, but COVID-19 is going to box it out, right? So what are your thoughts? I mean, what are you hearing in the community, your community, your medical community, from other physicians, from virologists? What are you hearing from them?
Yeah, great question. And I'll say that part of what I hear when I hear some of those very concerns from the patients, it may not really be that they need an answer, or that may not be their biggest concern. It very well could be fear of the unknown. It could be fear and anxiety around everything else that has happened around COVID. There is a mental health epidemic and burden that COVID has placed. It's a social illness, an illness of isolation. Relationships have changed throughout this time. People's economic situations have changed. So there may be lots of things that are factoring into why people feel or asking some of these very important questions. And I also remind people there are people that have a real fear of just that poke itself. So you try to unpack a lot of that. And we at Kedren, it's very important that we talk about the Kedren way, where we respect the dignity and worth of every human being, every individual that comes across our path, and that we respect and acknowledge their dignity and worth, where we treat people like people and where we value their experience and their time. And part of that is that we take the time to engage, to educate. Optimally, we vaccinate you, and then we want to charge and challenge you to become vaccine ambassadors and to go out there and be activated and help be that standard bearer so that you can get your neighbors, your classmates, your coworkers, your community vaccinated. So with that, I do remind people that for some, it may take 15 or 20 touch points, conversations, interactions to really feel safe, comfortable, confident, psychologically safe to make the decision to get vaccinated, to get a booster shot. Again, it is early to say, but I think that what we've seen with the Moderna and the Pfizer first and second dose, that the immunity waned after 6 to 8 months. It's quite probable there is an annual vaccine coming. And I really do believe, I'm an optimist, believe that this will become a more mild illness that we learn to live with. And you mentioned the once in 100 years, and I really hope that's true. We also know there are things happening. The climate is changing. There are more of us, dense housing. There are concerns about our access to water. Bugs are spreading in different and new ways. So we're going to want to continue to be vigilant. And there is some new normals. And this is a chance to wake up, a wake-up call, a reset how we interact with health, medicine, mental health, public health, because we need to be on guard. And I know the latest reports show we're not prepared. If COVID happened again tomorrow, we're going to be right back where we started. That doesn't make sense, and that's not okay. So we really need to keep building. But again, going back to the point of not going to be able to provide anyone that 100% assurance, not going to be able to really, I'm not a prophet and I don't have a crystal ball, but I do think the best thing that we can do is, as you said, when we say evolve, we take the information we have and we do the best we can. Just like I know parents, just like I know people in our community are trying to do the best they can for those they love. That's what we as physicians, that's what scientists, we're trying to do the best we can with the information we have so that we can help as many people as we can. So ultimately, that's how we came to these decisions. For example, why did we recommend that LAUSD students get vaccinated to stay in school? Because we saw the reality of the Delta variant and we saw the numbers rising. And with that information, the school made an informed decision. How did we come to the decision to allow 16 and older to be eligible for boosters, the Food and Drug Administration? Because there was enough safety data that showed that 16 and 17-year-olds can benefit and it's safe in them to get that. And that's really that whole scientific process. That's what drives the way we prescribe meds, how we diagnose, how we treat people every day. That's no different how we approach COVID-19. And when we're all collectively, like a choir, singing that same song, it really does mean something, and it resonates and bounces off the walls of the hall that we're in. You know, there's something to it. There's truth at the core of these messages. So we wouldn't be recommending this if this was harmful. You better be, I believe, I'd be the first person not to offer these vaccines. And if anything like that happened, I'll be the first person. And so the way I've just walked through this conversation, I end up often, it's like a conversion. It's almost like evangelism, being a missionary out there. You see people on the journey, and you see people go from refusal to hesitancy to reluctance to I will, just not right now, to fine, doc, I'm going to roll up my sleeves and go ahead and get that shot. I just want you to stop talking. So I really do hope that, you know, our words mean a lot. The message, who brings the message, all those things that are very important. But over time, I really do believe we'll get there, and we just want to empower people to make those decisions and to feel confident and comfortable. We are not going to ever coerce anyone. We're not going to force you. I'm not. As I tell every one of the patients I've vaccinated, I'm not going to give it to you unless you want it. And that's really the truth, because we'll hear people say, well, my boss made me, or there's a rule. Well, I don't care what rule there is. I don't care what your employer says.
Right.
You tell me you want it. And if you don't know why you need it or why you want it, let's spend some time talking about that first.
Dr.
Thank you.
Abraham, I appreciate that so much. Thank you, Alicia. I just was going to mention really quick to Dr. Abraham, just two essential points that I feel like are just absolutely essential. Dr. Abraham, you brought up so many great points, and from the community level, something that comes up so much that would be so helpful for you to just really quickly address, because Alicia is looking at me and she's saying, we are over time. And
no, we just have questions from individuals that are attending. So I was
yeah,
gonna ask that
and
question.
I was getting questions as well. And I'm hopefully maybe this question is also representative, but so we have Black folks and folks of color that say, okay, I'm looking at the news and people of color, people who are vaccinated, they're getting infected. Why should I go get the booster? Why should I even go get my first or second dose? Because they're infected and so could you talk a little bit, for example, to just drive home that immunizations have always been designed to be severity prevention versus eradication, and that if we look at the deaths, it is mostly among those who are unvaccinated versus vaccinated. So you might get infected, but you will be able to manage at home, and then maybe in 2 weeks you can go run a marathon versus being hospitalized. And just lastly, that when we, and this is coming up a lot at the community level, when we do have someone who's vaccinated and there is a severe reaction or hospitalization, to please remember that everyone's health condition is individual, and that if someone was already immunocompromised, because you mentioned that, or had a pre-existing health condition, your response may be different, and that's important in communities of color. And so, Alicia, respectfully, thank you. I just wanted to just bring that up, and I appreciate you allowing me to just mention those two items. So thank you very much.
Yeah, I'll answer those really briefly, because I know we do want to also answer those other questions, but I will say that I remind my patients every day, everybody, literally every person's body is different. And so to really, we respect and understand that individual piece of it. And I also remind people, especially earlier on when we did not have, now we've had, since the clinical trial started in the summer of 2020, we really do have 15, 20 months of experience with COVID-19 vaccines and data to support it. Earlier on, there were real concerns about experimentation. What we saw was, I look at the data that shows 99% of practicing physicians have gotten vaccinated. I look at who showed up in those earliest days, who drove from other parts, Beverly Hills, Malibu, whatever, came to South LA. I was like, you've never come to my neighborhood. Why would you be here now? They came to get these vaccines because they truly believed and knew these were their best strategies, their best tools at staying safe and protected. So really for our community, I wanted, and I still want people to hear, we want equal survivability. We should, and we want, and we demand, we live as long, live the best, live the healthiest, highest quality life, just like everyone else, just like people from other zip codes. And that's so important that people hear, and if vaccines help us do that, why wouldn't you take that? And I want people to feel empowered. And in fact, we've already paid the price. We've paid for these vaccines. They are all of ours. Why should you get in the back of the line? You should be, and that's what I did at Kedren. I made sure our community got front in line. Based on your zip code, you got in priority line number 1. Based on if you had somebody in your family get COVID, you got in the priority line. So there were ways that we strategically made sure our community were prioritized in ways that I was not here to get these vaccines for people from Beverly Hills and Malibu to travel and do medical tourism. You know, that was really important to hear. There was one other point that you had mentioned, but I will say that you're right. Vaccines are a very important tool in preventing death and serious illness. We're not saying that you're not going to get COVID. We're not saying that you're not going to get mild or that you're not going to not pass it, but the chances do actually decrease of all of those things as well. So yes, I know it's frustrating to see breakthrough cases. I know it's frustrating to be like, well, I got 2 vaccines and I tested positive, but that really isn't the end game or the goal. Are you alive? And that's what I tell grandmas every flu season. Grandma comes in and goes, well, doc, I got the flu shot and I still got the flu. And I go, well, did you end up in the hospital? Come to think of it, doc, no, I didn't. Did you end up on a ventilator? Did you end up with pneumonia in the ICU? Did you die? Well, doc, I guess it worked. And say, exactly. It did work. It did do exactly what it's supposed to do. You are here to tell me and be angry with me that I vaccinated you and you still got a mild flu. But with that, I'll turn it back over to Alicia because I know you had some other questions you wanted to ask.
Thank you so much. I do have one question for Shantay and then one last question for you, Dr. Abraham, and then we'll do a quick round robin and shut it down. So Shantay, the question I have for you is centered around, okay, so just so you all know, I try to, you know, I'm talking to my people, I talk to my people like I talk to my people, okay? So Shantay, I have a question for you. So mothers specifically, women and individuals that can bring forth life. I always highlight women because I'm a woman that gave birth and I always say that's my superpower. So I will always highlight women and individuals or persons that can give birth. And so with that said, one of the things that I like to tell people is if you get vaccinated when you're pregnant, you are cheating the system because your baby has the antibodies. You get to cheat the system. If you get vaccinated and you're nursing your baby, your baby just skipped the line without the clinical trial and got the antibodies. How does that work? Like, what are you seeing in the community when you're talking specifically to Black women and Black individuals that are pregnant and they're like, Miss Shantay, I'm scared. What do you say to them? What is your case? This is what I want you to answer. What is that one case that you have where you're like, I don't think this one is ever going to get the vaccine. And they came to you and they were like, I got vaccinated. What did you say to that person or what was said to them to get them to change their mind?
That is such a relevant and great question. And I'm sure also Dr. Abraham will have a clinical follow-up. So before I answer the question, I want to say and also validate that when we are pregnant and when we are giving birth, when birthing persons are bringing forth a new generation, they, all of us, the community, our goal is to birth the next generation of legacy. That is everyone's goal. No one wants to give birth to an unhealthy child. What we also know is that when you are pregnant and carrying, it is one of the most significant periods of motivation for someone to get healthy, to address underlying health conditions and to get them under control during pregnancy, because moms want to be healthy. Moms want to have healthy babies. And you want to know something? Moms put off their own health care. But what they will do is they will go to the doctor for their babies every single time. And so I just want to preface the answer with that. We know that moms are absolutely committed and dedicated to having healthy babies and healthy bodies during their pregnancy. So that's the first thing. So to specifically answer your question, I think that it's important to acknowledge the fear. Because moms are so dedicated to health during pregnancy, we must absolutely acknowledge the concerns or the rhetoric that has been heard. Because imagine if you don't work in the space of maternal child health, or you're not a health advocate, or you're not a physician, or you're not a nurse, or right? You just see what's on the news, you see what your friends are talking about. It's a lot of political rhetoric. It's like, what do you believe? There's so much information. And you must acknowledge the fact that there's a lot of misinformation, but then you also have to acknowledge the very real, genuine reasons of why you might be hesitant to get vaccinated during your pregnancy. So that's the first community response is, listen, you know your body. You are the expert for your own body. You know what you need. And our goal is to give you information and accurate education so you can make a good decision for you and for your body and for your baby. Because we're not here to force you to do anything. You need the education and the information. That's really important. So after that, after there's the information and the education, the second step from my perspective is, okay, you have the information and you have the education. Now, what are your specific concerns? And then let's address those individually. We can go through those line by line by line by line from a scientific standpoint so that you can make the best decision for your body. And Alicia, that really is the answer. We need to make sure that Black women and that women of color who are bringing the next generation in, that they have evidence-based science information. That's it. This is the information. If this is your concern, let me give you the resource, the credible resource. That's the key word, the credible resource to address what you just said your concern is. And in 30 seconds, let me say this. We know that there's a lot of concerns around male fertility, for example, right, with the vaccine. So if we think about this, if you are a male, and let's just say that we had never heard of COVID, and Dr. Abraham will follow up with this to make sure everything is scientifically correct. But let's just say that we'd never heard of COVID and you're a male and you get sick and you have a fever. There's actually a very brief period where your sperm count could briefly be impacted because of your fever. Briefly. That's very normal. That's been normal for thousands and thousands of years. It's very normal. So let's just say that you're a male and you are planning a family and you get your COVID vaccine. And let's just say that you are one of the few that maybe you have a little arm soreness, but maybe for one day you have a fever. So for one day you might have a fever, and maybe for one day your sperm count maybe could potentially maybe could for one day, be impacted, and just like any other fever, the next day, it's back to normal. So the COVID vaccine does not cause, right? There is not a causation of getting the vaccine and side effects. So that's my answer, Alicia, if it helps, which is mamas, know the facts. Reach out to your partners who have evidence-based, real information. Educate yourself. Decide based on the real information what is best for you and your family. Dig deep, peel the layers of the onion apart. And remember, like, oh my God, I had a side effects, my arm was hurting, I had a headache, I had a fever. Didn't you have that 10 years ago when you went to get vaccinated? And that's how come you took some Tylenol, because your arm was gonna hurt a little bit? Like, dig deep. And just one of the quotes by Martin Luther King Jr., right, our beloved, is one of the things that pains folks the most is to think deeply. Think deeply. Don't just go by what you hear on the news. Oh, he had a fever. I had a fever. The world is ending. No, the world is not ending. Go do some research. The very last thing that I will say in regards to fertility and trust, our bodies, how we respond, and I'm going to really leave it to Dr. Abraham to finish this off, is Dr. Abraham mentioned earlier that we as a society consume things and we do not necessarily ask, what's in that? What's in that? What's in that? You just go, if someone says, take some acetaminophen, take some Tylenol, go take that ibuprofen. You just go and you take it. You just go to McDonald's and you eat the chicken nugget. You don't actually break it down, the ingredients. Like half the time, you can't even say what the ingredients are. You don't do that. Here's my closing thought. These vaccines have proven to be in the 90% percentile effectiveness. Some of the other medications that we know, love, and trust that we take are in like the 30% percentile effectiveness. And we don't question those. We don't go look up the ingredients. We just take them. Dr. Abraham, I am going to really hand it over to you at this point for the effectiveness.
Yeah,
Thank you, Alicia.
I really appreciate that. I'll just add really briefly, because I know, Alicia, you had that other question you wanted to get to. And if it's all right, I'm happy to answer that as well. I see the 5-year-old question in the chat, but I'll just start by really quickly just saying, very important points. There is no association between these vaccines and infertility, no association that has been observed to date. There's been data published, no effect on these vaccines and pregnancy, ability to get pregnant by women, no harm during breastfeeding. People have had these vaccines and then gotten pregnant. We have seen many Black women physician colleagues get their vaccines, then get pregnant, get vaccinated while pregnant, and get vaccinated while breastfeeding. And we have no reason to believe this would affect a man's fertility. It's also important for parents to hear there's no evidence that this affects children going through development and puberty. So just want to echo that for sure. But definitely some very important points there about effectiveness. These are some of the most effective treatments that we have ever evolved, and some of the safest treatments. They're very specific to the spike protein. They are the side effects profile is very low compared to other treatments, as you mentioned. Alicia, did you want me to go on to that question, or? Okay, so there was that question about my child is turning 5 in a week. Should I wait a few weeks? I personally always say get the vaccine that's available for you today. Today, there's no vaccine available for him, but on his birthday, there is a vaccine available for him. Why wait? Why delay? Especially given that it'll be right in the middle of this holiday period when we're out of school, we're gathering at home. As Shantay mentioned, is that even though we may get some mild pain or swelling, maybe possibly fatigue, tiredness, maybe a fever, for one day, 1 or 2 days. In exchange, you get protection. You get protection. You get a license to live if you did get COVID-19. I would definitely, those bets, I would place my bets on the vaccine any day. And so I'd approach this by saying the day that he is eligible for a vaccine is the day that we should try to find a way to get him vaccinated and not wait too much longer after that. Back to you, Alicia.
Thank you. We'll say that's his second birthday gift, giving him life. I just want to follow up on two things before we wrap this up. Number one, Shantay, when you were talking about the sperm count, one of the things that I love talking about, especially when I do webinars with brothers, is the vaccine does not cause those issues, but COVID-19 can cause erectile dysfunction. And I could literally have like a 30-minute conversation about that.
How about 30 hours?
Oh, yeah,
how about
sure.
30 hours?
Exactly.
How about if we also bring in, for example, for all of our populations, marijuana, for example. Dr. Abraham probably has a lot to say about this, but just to keep it really succinct, from a community level, you are absolutely right that this is something that gets brought up in terms of dysfunction. What we know is that, number one, the COVID vaccine does not have a scientific causation or correlation with erectile dysfunction. That's the first thing to remember. What we do know is that not being vaccinated and being infected with COVID does have a correlation and causation with erectile dysfunction. And again, Dr. Abraham will follow up, but what we need to say at the community level is like, listen, if this is important to you, you need to get vaccinated. That's it. That's the
really
bottom line.
quickly, in addition to the vaccines, or if you have COVID, if you're that concerned with erectile dysfunction, I will tell you right now, then let's get our sugars in check. Let's get our blood pressures in check. Let's make sure our hearts are working well, because those are probably affecting things like that, fertility way more. So while we may be perplexed and fixating on things like the vaccine, there are so many things well within our control today that we're not doing it. So if we can get people to reset and go, hey, you know what I can control? How much sugar I ate today, and how much sugar I ate today affects that.
Exercise. Thank you, Dr. Abraham. You just said it. You said it earlier when you talked about comorbidities and different diseases, right, that affect the whole body. From a holistic standpoint, listen, we have to get our bodies healthy. That's it. That's really the bottom line. We've got to get our bodies healthy to the extent that we have the power to do so. Because I also want to be respectful of determinants of health. I want to be respectful of how our neighborhoods are structured. I want to be respectful of the different resources that folks may or may not have. But I also want to just keep it real and authentic, like Dr. Abraham said, and say, don't be so concerned about the vaccine. Be more concerned about, okay, maybe if you don't live in the best neighborhood where you can go out and exercise and there's not lights and a sidewalk, do you have access to YouTube where you can put on an exercise channel and you can exercise right in your living room? So
thank you. And so I think you both gave us a great summation. If you all have any additional questions, please reach out. But one thing I want to say before we leave, our healthcare workers, our nurses, our doctors, our public health professionals, health communicators, those of us that sit behind a screen many days a week talking to people, those that are outside talking to people. I've worked at vaccine clinics, talking to people, handing out literature, holding hands, getting my hands squeezed so hard, all that good stuff. We're tired, y'all. So if you could encourage your loved ones, yourself, if you have not gotten vaccinated, if you could encourage yourself, encourage others to take that step, go get your booster. to the individual that asked about the Johnson & Johnson and needing the booster, please go get your booster. I know them personally, so that's why I'm calling it out. So if you could please do that, but know that our healthcare workers are tired. There was a young lady that I was speaking with. She's been in nursing for 20 years. She's retiring. She's an ICU nurse. She can't take it anymore. She says she is having a nervous breakdown. So if you could please think about your healthcare workers, think about our fragile healthcare system, especially those of us in Los Angeles County, that if you drove past the hospital last winter, you saw EMTs lined up, people sitting outside. They put out a letter stating, oh, if you are going to need healthcare services, the EMT gets to determine if you'll survive. And that was very dangerous to our Black and Brown community specifically. I mostly thought about South Central because that's where I grew up. I still call it South Central, Dr. Abraham, because that's where I'm from. So yeah. So
Alicia, what spa is that?
oh goodness, spot 8.
All six.
6.
No, I'm being.
Spot 6. Oh, I was like spot 8, spot 6. Oh, you caught me. But again, if y'all could just think this through. If you have not gotten your booster, make your appointment. It's super easy. You can go to My Turn, Google My Turn, .ca.gov, and you'll be able to schedule an appointment anywhere you put in your zip code, and it'll give you a list of places. Some clinics are walk-in, some clinics you do have to make an appointment. Dr. Abraham, is Kedren still a walk-up clinic?
That's correct. Every day you just walk up and get your vaccines, your booster shots, one-stop shop testing. It's all important.
Give us your address.
Yes, and South Central, South LA, absolutely. We're at 4211 South Avalon Boulevard in South LA, Kedren Health. You'll see the line. Every day there's a line of people out the gate wanting a vaccine. And
Awesome.
we're really thankful and blessed for that.
Awesome. So we
Dr.
want to
Abraham, one more time so I can type it into the chat, just really quick.
Yes, Kedren vaccines. We're at 4211 South Avalon Boulevard in Los Angeles, 90011.
Awesome. So I want to thank Vaccinate All 58 for this partnership with Advantage Health Now. And thank you again, Dr. Abraham and Ms. Shantay for joining us tonight. And everyone, I would say, have a safe trip home. I'm going to say that to Dr. Abraham. The rest of us, have a good evening.
Thank you so
Bye.
much. Bye-bye.